Alright, so I hope that I'm audible to everyone. So, what we are going to be going through today are some of the potential questions that could come up in the aptitude test. So, this is just to give you guys a small preparation of the possible questions that can arise from the aptitude test. So now I'm not someone who has done this test before because it's not part of the examination process for the selection of foreign students to study medicine at KDU. So this is just for the local students who have started a couple of years back. But this I thought could be some of the questions that could arise. So I wanted to go through some of the common knowledge questions as well as some possible abstract reasoning questions that can be asked for the IQ knowledge paper. So let's get started. You guys can drop your questions and your answers for these questions as we go on throughout uh, this throughout this session. Okay, so okay. Now we're gonna start with some of the general medical knowledge questions, starting from questions such as this, like what is the primary role of a general practitioner? So is it to perform major surgeries, to provide specialized hospital care, diagnose and treat common illnesses and refer to specialists if needed, or to dispense medications directly to patients? So, based on your knowledge, what do you think could be an answer for this question? And you have to keep in mind that most of these questions are addressed to someone who has just finished A levels and have basic knowledge of biology and don't know anything about medicine, but they expect you guys to know at least a few things about the things that you're expected to know as a recent A level graduates coming as a prospective medical student, first year medical student. So, based on this, what would you say could be the answer for this first question? So, general practitioner would diagnose and treat common illnesses and refer to specialists if needed. So, usually, general practitioner are trained to know about 1,500 to 2,000 different conditions, and if it goes beyond the spectrum, then those patients will be referred to specialists at tertiary care hospitals in order to help out the patient even further. Okay, so dispense medications directly to patients, they do that, but it's not as simple as that, so it goes a little bit beyond that. So they don't provide specialized hospital care. Like I said, those will be the specialists within tertiary care centers that provide those facilities to the patient, and they don't perform major surgeries. General practitioners are not surgeons. So, which of the following is not a core duty of a doctor according to the General Medical Council? So, is it to maintain patient confidentiality, to prioritize patient welfare, always agree with the patient, or to provide care without discrimination? So, based on this, C would be the best answer. Always agree with the patient. So, there's not a core duty of a doctor. Okay, confidentiality is very important. It's a key fundamental quality that a doctor should possess. So whatever it's the patient tells you, it stays within you and the patient. So you are not allowed to break confidentiality with other people unless, let's say that you want to talk with your medical team. You cannot do that unless the patient gives you consent to do so. Okay, so that's one quality that a doctor should possess. So it is a core duty of a doctor. And to prioritize the patient welfare, I think that's a given. There's no need to explain much on that, right? You're basically acting on the best interest of the patient, and you're trying to save essentially the patient's life. Provide care without discrimination, again, is very important. This falls under what we call the ethical pillars of being a doctor, which are beneficence, non maleficence, justice, and to provide autonomy. Autonomy essentially means that a patient has the right to agree to whether they want to want to continue with the treatment or not. Okay, so it's completely up to the patient to decide whether they want the treatment or not. So in this case, it's all about curing a patient without discrimination. So for instance, if you take a patient who comes from a good family background, who has a lot of money, financially is doing very well, or you're getting a patient who's coming from a much poorer background, don't have much money, so you as a doctor, you cannot provide care to only to the patient with the best financial capability, but also you have to treat the same way as someone who comes from a poorer background. So that's again one of the major core duties. So always agree with the patient is something that you cannot do all the time. So it's not a core duty of being a doctor. Okay, so let's move on then to the next question. The term triage in medicine refers to a type of surgery ranking patients based on the severity of their condition, disinfecting surgical tools, and transporting patients to the hospital. So, based on this, ranking patients based on the severity of their condition is what we mean by triage. It's not a type of surgery, it's not anything related to surgical tools or transporting patient to the hospital. So when we get patients coming to the hospital, especially in accident and emergency, we essentially divide the patients. We rank the patients with different colors depending on the severity of the condition. So if someone comes from a mild abdominal pain, or if there's someone coming with a fracture, or let's say to the wrist or to the arm, and someone else comes with a heart attack, so the person with the heart attack gets the most priority, followed by the person with the fracture, because there's still a possibility of bleeding and possibility that this patient might soon in time go towards much more a lot more complications. And the person with the abdominal pain who might be having a stomach ache, for instance, will be will be ranked with a much lower uh, ranking or severity. Okay, so that's basically breaking. I'm trying to break this down as much as possible so that you guys as just fresh A-level graduates understands these terminologies. Okay, otherwise things become a little bit more difficult if we start to speaking in a more medical student or medicine related type of way. Okay, then moving towards science and medicine, what is the main function of a red blood cell? Is it to fight infections, help in blood clotting, transport oxygen, or to regulate body temperature? So I think this is a given for anyone who's done biology. I think this is one of the most easiest questions to answer, right? So it's about transportation of oxygen. Antibiotics are effective against viruses, fungi, bacteria, or all microorganisms. So again, this is a very straightforward question. So antibiotics for work against bacteria. Okay, so these are the common things that you're supposed to know. So when we talk about antibiotics, you need to know about penicillin. There's a very important person that has discovered penicillin, has given rise to all of these antibiotics that we use today. So that's Sir Alexander Fleming, a medical doctor doctor from a British medical doctor. So that's again another question that could come up in your um, general paper. Okay, so that's someone that you're supposed to know. So what happens if the patient does not complete a course of antibiotics? They will develop immunity, the infection will disappear faster, the infection may return, and bacteria may become resistant. There will be no effect. So the answer for the question would be C. The infection may return and bacteria may become resistant. Okay, so that's one of the, unfortunately, one of the most complications that we have right now when we prescribe antibiotics to patients. Unfortunately, a lot of antibiotics are given to patients unnecessarily. So whenever a patient goes to a doctor to get treated, this essentially happens in OPD settings or family doctors or those medical centers that you see throughout the city, right? Patients expect medications even if it's a viral flu. So a lot of the times these doctors give out antibiotics unnecessarily. Okay, so what happens with that is that over time the bacteria become resistant to these antibiotics. So when you're trying to treat them in the future, the likelihood of these antibiotics to work is very minimal. So that's why one of the things that we are seeing right now, and that later on as we become doctors in the future, we become consultants, this may become even more serious, where a lot of the conditions that patients have, we as doctors are not able to cure them anymore with antibiotics because they are now resistant. And now we need to find different ways to treat them. Hopefully in the future we might have different sort of medications, new antibiotics that we can use in order to treat our patients. Okay, so the answer for 6 then, the infection may return, antibacterial may become resistant if the patient does not complete the course of antibiotics that has been given for the patient to complete. So for instance, if antibiotic is given for a week, it can be given twice daily or can be given once a day for a week. If the patient, let's say, takes it only for 5 days instead of the 7 days, because now by the 5th day they start to feel better and they completely forget about the medication, or they think, I don't need to take this medication anymore because I'm doing fine now, and they stop taking it the 5th day, then the infection might not have been cured completely. Some of the bacteria might have been left behind in the body and they will start to replicate again, right? So I think this is simple biology that you guys might remember from your biology days. The bacteria will start to replicate, will start to grow again, and now they are less susceptible to the antibiotic. They are much more resistant to it. So that same antibiotic might not work, or you might need to give a more aggressive dose of that antibiotic. If you guys have any questions, feel free to use the chat and ask questions, okay? Right, now let's talk a little bit about medical ethics. Now, this is important not just for you guys to pass this aptitude test, but what I see is that a lot of the medical students, especially all the cadets in our batch when we started, had very little knowledge about medical ethics at the time. So I suppose by the time you guys start also your course, you won't know much about medical ethics because it's not something that gets taught to you during your A-level days. Unlike us, for us, the medical ethics was extremely important prior to enter medical school. So a lot of these things were already taught to us. So I think these sort of questions and fundamental things that you need to know as a medical student even prior to get to medical school. So let's see now this question. A patient refuses a life-saving blood transfusion for religious reasons. What should the doctor do? Ignore the patient's wishes and proceed? Call the police? Respect the patient's decision if they have capacity? And transfer the patient to another hospital? Okay, so based on this question, respect the patient's decision if they have the capacity would be the answer, the appropriate answer. You as a doctor, what you try to do is to save the patient's life, but you cannot do that going against the will of the patient. That's what now we are going back to that, those ethical pillars that I mentioned earlier, the four ethical pillars: autonomy, beneficence, non-maleficence, and justice. So this falls under autonomy. The patient has the right to say no to their treatment based if they have capacity. Now, what do we mean by capacity in very lay terms? Capacity is basically where the patient understands what you as a doctor are trying to do. So in this case, you're trying to give a blood transfusion in order to save the patient's life. And why it is important, so again, to save the patient's life, and because there are no other ways for us to treat that patient. So if the patient is able to understand this information and also the complications that might come if this patient is not to get the blood transfusion, or the advantages that can come from the blood transfusion, if they understand all of this information, then if they say no, then they have the right to say no. And as doctors, we have to respect their decisions and obviously find a different way, if possible, to treat this patient. Okay, so if they don't have the capacity, then it's a different story. So there are different ways to assess the capacity of the patient, but we are not going to go into details here. But I think at this level right now for you guys, that's more than enough. Okay, so this is a very important medical ethical question that can come up. So that remember this question. And then informed consent means what? Doctors can do whatever they want after informing the patient. The patient signs a paper before surgery. The patient understands and agrees to treatment voluntarily. A family member gives consent on behalf of the patient. Okay, so if we examine the first statement, doctors can do whatever they want after informing the patient. That is no. Again, this is autonomy. So you can't do whatever you want after informing the patient. The patient signs a paper before surgery. So yeah, if they sign a paper before surgery, it's consent, and they are agreeing to uh, they're basically agreeing to do the surgery. The patient understands and agrees to treatment voluntarily. So that's again type of informed consent, and a family member gives consent on behalf of the patient. So most of these questions are very similar to each other, but when we look at all these answers, the best one is the patient understands and agrees to treatment voluntarily. So the patient has the capacity to understand and agrees to the treatment voluntarily, is the informed consent in this case. Okay. B is also a type of consent, but it's what we call a written consent. And this one is an informed consent, which will be C. Then breaching patient confidentiality is justified when a patient has a terminal illness, the patient is famous, it is necessary to protect others from serious harm, and the doctor disagrees with the patient. So it is necessary to protect others from serious harm would be the correct answer when we talk about breaching confidentiality. Now, as an example, I can give you, let's suppose there is a patient, a male patient that has arrived to the GP, to the general practitioner's center to see a doctor, and says that they have been sexually active recently and they have had unprotected sexual intercourse with multiple partners, and he's married now with a wife at home. And to keep things very simple, their HIV test has become positive, and he's also been sexually active with the wife in the past. but the wife doesn't know that he's been active with other partners as well. So now there is a huge risk that maybe the wife herself might have encountered HIV because of the husband. So what do you do in this case? You have a patient, a potential patient at home who doesn't even know that she might be having HIV, and you have a patient at the center with a positive report that says they have HIV. So how do you deal? How do you deal with this case? So what you can do as a doctor, because you have to respect the confidentiality of the patient, you have to speak with your patient and let him know that he has to bring his wife to the general practice in order to be checked out and see what the patient is saying. In cases, in very good, if the patient is very good with you, then what more might happen is that the husband will call the wife and will come to the general practice together to get the wife checked out as well. But because in this case, obviously, the husband is cheated and the wife doesn't know about it, there could be problems there within the relationship, so the patient might not want to do that. So you are, as a doctor, you have to give a chance to the patient, initially a chance to the patient to help out the wife. If the wife doesn't help, if the husband doesn't want to do that, then you have the right to breach patient's confidentiality, to go against the will of the patient in order to protect the wife as well. So you can call directly the wife and say, look, this has occurred. You might want to you might want to check yourself for HIV, and then you'll be able to bring the patient to the general practice in order to get herself checked out as well. Okay, so this is a case where you're able to breach patient confidentiality in order to protect other people at the same time, in order to prevent serious harm. Right. Then question number 10, antibiotic resistance is a concern because it makes antibiotics cheaper, it reduces the effectiveness of vaccines, infections become harder to treat, it only affects developing countries. So again, the right answer is infections become harder to treat, which is something that we saw earlier as well. Right, so that concludes the section on general knowledge. So these are very medicine related questions that you could get, but obviously, as you might have seen from the papers as well, there are a lot more other general sort of questions that you can get about Sri Lanka and other countries as well. Okay, so those things can come as well. So I wanted to focus mainly on this sort of medical related questions. So if you guys have any questions you want to ask, please feel free to use the comment section below. So now we're going to move on to the abstract reasoning questions. So all you have to do here, I'm sure you guys are familiar with these sort of questions. You might have done them before for your selection processes in school. Okay, so if you haven't done these sort of things, it's okay. We can use this session to practice. So essentially, what you need to do here in this question is to complete this series. So you're given 4 questions, 4 images. So you need to find another one that matches this series. Right, so what you can see obviously is a triangle that it's mostly, as you can see here, they're mostly pointing to the right. And then when we look over here, right, so when we look over here, so what we are seeing is that most of these pictures are facing the other way. So out of these ones, this is the only one that seems to be facing series on the right. Okay, so that's why it's the one that we take for the completion of this series. Okay, the other ones are facing the other way around. So if you look at this once the figure completes this series, what do we see? So we can see that there are 4 squares here. Here there are 5, 6, 7. So what we are expecting to see is a square with 8. So we have one here, and we have another one here, another one here. So D is excluded. So how do we select these ones? Okay, so this one would be A. So we can see that there's a continuation of the pattern. So we have the 4 black squares, and then we have an additional black square coming on this side. Okay, so which figure completes the series? So we can see that there are 4 squares on either side. So this square is now moving to up here, and then from here it's moving to the right upper corner, and then from there it's moving to the right bottom corner. So now we should expect something that moves to the left bottom corner again. So we have A, C, and D. So that excludes B right there. And then what we're seeing also is this line that it's moving from the middle to the right top corner, and then from there again to the middle on the left, and then it's moving here again. So the common pattern here is that it's moving by half of the square and a quarter. Okay, and then from here again it's moving by half and quarter. From here it's moving a half, so this point, and again a small piece to the right. So what we expect to see, some again it moves by half, so it should be here, and a quarter, so it should be here in the middle. So if you look at both the schemes, C is the appropriate answer. I hope that makes sense. Okay, so the line has to move by half and a quarter, so it should fall in the middle, and this tiny black corner should move to the left. So C is the appropriate answer. If you look at this one, now we have a black and white rectangle. So those two figures have now moved from horizontal position to a vertical position. Again, horizontal, vertical. So we are expecting the next one to be horizontal. So it has to be either B or C. And what we see is that the black rectangle is slowly becoming white, and the white one is becoming black. So then we are expecting the original white one to become black, and the black one to become white. So C is the appropriate answer. White becomes black and black becomes white overall. Okay, looking at this one, which figure completes the statement? So this is to us, and this one is to what? Okay, so what we're seeing is the small black square is moving from the left to the right, and the big white rectangle is moving from its bottom position to an up position, so you can see here. Okay, so then that means that this black one should move up, up here, and this white square should move to the right. So do we have anything like that? Yes. Okay, so B is the right answer in this question. So the way you answer these sort of questions is you look for patterns. Sometimes it could be the number of sides that is the same, and sometimes the angles could be different, the position of things can be different, or sometimes the squares change color. So those are the things that you need to be looking for. So in this case, you can see how they're moving positions, so you're expecting the other one to follow the same sort of pattern. Okay, so now looking at this, what we see is that this cross has now become a square, a white square. The black square is still there, and these two parallel lines running together in the middle have now become vertical with another line, black line, in the middle. Okay, so from its horizontal position now it become vertical with an additional line in the middle. The squares moved from its right position to the left, and the cross has now become a white square. So now we expect this cross to become a square, white square over here. We expect these two middle lines to now become vertical with a middle line, and we are expecting the bold black square to move from left to right. So we have a left to right over here. The cross has now become a square, and the lines have now positioned itself in the middle with an additional line. Okay, so D is the right answer in this case. Right, so to answer the question, brother, they asking subject knowledge questions for medicine. They told it's only general knowledge, IQ, and English papers. Yeah, so from what I've seen from the papers is they have different papers for each subject. Whether it's engineering, finance, administration, they have the set of questions. So some, I suspect for medicine, it will be if they'll have different questions that will be asked. So they could ask questions related to medicine and bio. Okay, so things like antibiotics questions they can ask. Okay, so antibiotic is a very general topic that you guys also start during A levels. So famous people like Sir Alexander Fleming, discovery of penicillin, those are very subject related questions that they can ask for in general knowledge questions. Okay, these sort of questions may come up or may not. Okay, so this is just a small session for you guys to get aware that these sort of questions may turn up on the day of the exam, or they may not, but it's obviously better to come prepared with these sort of questions as well. Okay, so there's no need to focus, don't panic now that if you don't know these things. Okay, just read a little bit around. You can use ChatGPT as well. You can ask ChatGPT to come up with general questions that get asked in medicine from A-level students. I'm sure it will come up with a lot of different questions that you guys can practice and learn. Okay, so you can do something like that. You can look for famous people in medicine and what their discoveries are. Like for example, DNA is again something you guys have studied for biology A levels. So who are the people that they came up with the shape of the DNA. So things like that they might be asking, because these are very common questions that they can ask. Right, so someone is saying D for this answer. Okay, so let's analyze this question. So what we're seeing is a black circle with two vertical squares, that are in black, and then two horizontal squares in white. And what we're seeing here is a black rectangle and a white rectangle underneath. So essentially we are looking at the pattern in colors in this one rather than position. So the black vertical now has become black horizontal. The positioning is there as well in this question. And the white squares that were originally horizontal and now become vertical. So what we expect to see here then, the black ones in this position should fall in this position instead. So they'll be reversed. So this position here will be black this time. Okay, so the person that said D is correct. Okay, so we have the black ones in this line, and the other diagonal line is now white, so it's D. So which figure is the odd one out? Right, okay, so what we are seeing, we have a square and a triangle, and in this case we want to see they're all the same. The number of triangles, you can see they're all the same in all of them. The pattern is the same, but what we're seeing here is that the triangle is found always on the left of the square. So you can see here this triangle is found on the left of the square. It's also found here on the left. Here it's also on the left, but in this one is on the right. Okay, so it should have been here, but instead of being there, it's here on the right. So E is the right answer. Which figure completes the series? Right, so what we are seeing here, we have two black lines and two white lines going diagonally. Here the black lines are going vertically and horizontally, whites are going diagonally, and here again there's the horizontal pattern. Here again we have the horizontal pattern, so the diagonal pattern, again another diagonal pattern but reversed, and the horizontal vertical pattern. So here we have the horizontal and vertical pattern, we have a diagonal pattern here, so we are expecting to see another diagonal pattern. So these ones should be the black ones. So this would be the right answer. Okay, we already have this one. Sorry. We already have this. We already have this one. This is not correct because this one should also be black to follow the sequence. So this is the right image for the sequential. Okay, so it's B. Right, so this is all I had for today. I hope that you guys have learned something from this small session. So these are sort of questions that they can ask. These patterns, I don't know much if they'll ask these sort of questions. There'll be some medicine related question or biology related questions during this aptitude test, but at least these sort of abstract reasoning questions will definitely come. Those were present in the aptitude test. Okay, so to get yourself ready for the medicine section, just go through important people in medicine, their discoveries, DNA, biology related questions. So those are the sort of topics that they might ask in medicine. Okay, just don't take everything that they say by heart, because they won't obviously say everything, so you need to come as much as prepared as you can. And as we said, we don't know how they're going to be taking this aptitude test properly, but obviously there's a Z-score and your sports activities are the things that they look at. But there could be cases where, for example, two students with very similar Z-scores to each other, they performed really well in the Z-scores and sports achievement. How are they going to select those two students? They're going to look at the interviews and they're going to look at the aptitude test results. Okay, so you don't want to be in that position where you you're competing with another student where you have the same grade. Let's say that you have been given a grade of 10 out of 15, and you both have 10 out of 15 as an example. How are they going to select you? Obviously, they're not going to select both of you. They have to select one student. So they'll be looking at these things: the aptitude test, how you performed in interview, those sort of things will be looked at. So obviously, don't take this sort of test lightly, even though in the policy it says that they're not going to be using this for your selection process, as it might be the reason for you getting selected to the course, or for you to being failed. So all the parts of this selection process is important. Okay, so I'll go through also an interview, how to answer the interview, like things like tell me about yourself, the sort of things that you need to tell them, and how to answer the questions like why medicine, why do you want to study medicine at KDU. So these are things that you need to research right now in your spare time by looking at the website. They have a full website now on the medicine section on the website. You can go there and study everything that they have. The hospital that they have, where is it located? Is a secondary or a tertiary or a quaternary hospital? You should know the difference between those terminologies that I mentioned. What is a tertiary hospital? What is a quaternary hospital? What are the services provided at that hospital? Why do you want to study at UHKDU? Why KDU instead of other universities? Okay, so when you answer that question, why do you want to study at KDU instead of a government hospital, obviously your answer cannot be that your Z score is not giving you the chance to study at a government hospital, that's why you're trying to KDU. Okay, that's the lamest answer that you can give. You need to be a bit more original to your answer and say, for example, KDU provides a lot more services and opportunities to study instead of being able to study at the government universities. I've heard about from previous students that lecturers are very enthusiastic and they teach a lot. So I want to be a university where I get taught a lot, because it helps me to be a much better medical students. And I don't know if you guys have seen, like today we had a neurology quiz. We came second in that competition. Last year we came third. So we are always ranking within the first 3 positions in a lot of the quizzes that are available throughout the year. Okay, so obviously that means quite a lot. So about the level of teaching and the preparation that it's given to medical students. So these are the sort of things that you want to show to them, because it shows that you are researching about the university. You are not just applying to the university because you want to study medicine. It's just another opportunity that has come out for you to study medicine. Okay, you have to show that you're passionate and you're enthusiastic. So I will go and do another session later on as we approach the interview sessions. But keep in mind, those are the sort of questions you want to answer. You should have a good, proper, passionate answer for those questions. Alright then, so I see no one else has any other questions. So I'll stop here, and I hope you guys enjoy today's session. If you want more sessions, obviously let me know. Comment in the section if you want more things like this, so I can prepare them and we can do them together. Okay, otherwise you can obviously use the group comment section if you have other questions that you guys want to ask. Okay, so with that said, no questions in the comment section. I'll go to end the stream now today. Thank you for joining, and I'll see you guys in the next session.